You've been in therapy for 3 years, every week, 50 minutes, talking about your childhood, your anxiety, your depression. You're still anxious, still depressed, maybe worse than when you started. But your therapist says you're making progress. These things take time. We're peeling back layers. Keep coming back. So you do? Here's what they don't tell you. 50% of therapy clients show no improvement. 5 to 10% get worse. Therapists have a financial incentive for you not to get better. More sessions equal more money. The mental health industry is worth $300 billion globally. It doesn't profit from curing you. It profits from chronic patients. Tonight, I'm exposing how therapy became an industry designed to keep you sick, not make you well. This is Inner Pigment. The research they don't tell you. The effectiveness question. Does therapy work? The mental health industry says yes, absolutely, scientifically proven. Let's examine what the research actually shows. The meta-analyses. Multiple large-scale reviews of therapy effectiveness. The results are not as clear as you've been told. Study 1. Wampold and Email, 2015. Meta-analysis of hundreds of therapy outcome studies. Finding: approximately 50% of clients show meaningful improvement. That means 50% don't. Coin flip odds. Study 2. Lambert and Ogles, 2004. Review of psychotherapy outcomes. Finding: 5 to 10% of clients deteriorate during therapy. They get worse, not better. Study 3. Kijpers et al., 2010. Depression treatment specifically. Finding: effect size of therapy is moderate at best. Many clients who improve would have improved anyway without therapy. Natural remission rate for depression: approximately 50% recover within a year without treatment. The publication bias. Here's the problem with therapy research. Positive results get published. Negative results get buried. Studies showing therapy works, published in prestigious journals. Studies showing therapy doesn't work, rejected, unpublished, hidden. This is called publication bias. It makes therapy look more effective than it actually is. Rosenthal's file drawer problem. For every published study showing therapy works, how many unpublished studies showed it didn't? We don't know. They're hidden in file drawers. The placebo effect. Many therapy studies don't control for placebo. The placebo effect in mental health treatment is huge, 30 to 50% of improvement, just from believing treatment will help. So when therapy shows 50% effectiveness, how much is actual therapy? How much is placebo? Hard to separate. The therapist incentive problem. Who funds therapy research? Pharmaceutical companies, insurance companies, therapy organizations. They all profit from therapy continuing. None of them profit from therapy ending quickly. Conflict of interest. They're not going to fund research showing therapy doesn't work, or that most people get better on their own. Cultures without therapy. The assumption. Western mental health model assumes therapy is necessary. Everyone should go to therapy. It's self-care. It's health maintenance. But most of human history had no therapy. Most cultures today have no widespread therapy. Are they worse off? Traditional societies, traditional cultures, rural communities, indigenous populations, no psychotherapy, no licensed therapists, no 50-minute sessions. Mental health outcomes, often better than Western societies, lower depression rates, lower anxiety, lower suicide rates. How? Community support. In traditional societies, mental health support comes from family, extended family, neighbors, religious community. When you're struggling, your grandmother moves in. Your aunt brings food. Your neighbor checks on you daily. You're embedded in a web of relationships, not isolated seeing a stranger once a week. Meaning and purpose. Traditional cultures have clear roles, clear purpose, clear belonging. You know who you are. Farmer, mother, elder, craftsman, you know your place in the community. Modern Western culture. Find yourself. Create your own meaning. Be whoever you want to be. This creates existential anxiety. Therapy tries to solve it, but therapy can't give you what community and purpose provide. Stigma reduction. Interesting paradox. Western cultures, therapy is normalized. Everyone should go to therapy. Mental health diagnosis rates skyrocketing. Depression, anxiety, ADHD, bipolar, personality disorders, all increasing. Traditional cultures, no therapy. Mental health issues considered normal life struggles. Diagnosis rates, much lower. Are traditional cultures actually healthier, or do they just medicalize less? The Japanese example, Japan, modern developed nation. Therapy culture much less prominent than America. Mental health outcomes, depression rates, lower than United States. Anxiety rates, lower than United States. Suicide rates, higher. But this is cultural, different issue. How do Japanese people cope without widespread therapy? Family support, community ties, cultural practices like meditation, tea ceremony. They manage without therapists. The evidence. Cross-cultural research shows societies with strong community bonds have better mental health, regardless of therapy access. Societies with weak community bonds have worse mental health, even with widespread therapy. Therapy tries to replace what community used to provide. It can't. The medicalization of normal human experience, the DSM expansion, Diagnostic and Statistical Manual of Mental Disorders, the DSM, the Bible of Psychiatry and Psychology, defines what counts as a mental disorder. DSM-1, 1952, 106 disorders. DSM-3, 1980, 265 disorders. DSM-5, 2013, 297 disorders, nearly tripled in 60 years. Did humans suddenly develop 200 new mental disorders, or did the profession expand its territory? Normal sadness becomes depression. Grief used to be normal. Someone dies. You're sad for months, maybe a year. This was expected, accepted, supported by community. DSM-5 changed this. Now, if you're grieving for more than 2 weeks, you can be diagnosed with major depressive disorder. Normal grief medicalized, now treatable, billable, profitable. Normal childhood becomes a DHD. Children are energetic, distractible, impulsive. This is normal childhood. But sit them in a classroom for 6 hours? Force them to stay still and focus? Many can't. Solution? Medicate them. ADHD diagnosis rates in children, 1997, 3%, 2016, 10%. Did children suddenly become more hyperactive? Or did we medicalize normal behavior that doesn't fit institutional settings? Normal shyness becomes social anxiety disorder. Some people are introverted, shy, prefer small groups. This is normal personality variation. DSM, social anxiety disorder. Symptoms: anxiety in social situations, avoiding social events, fear of judgment. Congratulations! Half of introverts now have a disorder, treatable, with therapy and medication. The profit motive. Every new disorder creates new patients, new therapy clients, new medication prescriptions. Who benefits from expanding diagnostic criteria? Therapists, more clients. Pharmaceutical companies, more prescriptions. Insurance companies, more premiums for mental health coverage. The DSM is written by psychiatrists, many with financial ties to pharmaceutical companies. Conflict of interest. The harm. Medicalizing normal human experience causes harm. You're sad? You have depression? You're worried? You have anxiety disorder? You're quirky? You're on the spectrum. This creates identity based on diagnosis. I am depressed. Not. I feel sad sometimes. Learned helplessness. I have a disorder. I can't help it. Dependence on treatment. I need therapy and medication to function. When actually, you're having normal human emotions in a dysfunctional society. The therapist incentive problem, the financial structure, therapist income model, charge per session, typically $100 to $250 per session. More sessions equal more income. Fewer sessions equal less income. What's the incentive? Keep clients coming back. The chronic patient model. Medical doctor treating infection, prescribe antibiotic. 10 days. Patient cured. Done. Doctor doesn't benefit from patient staying sick. Therapist treating depression or anxiety. Weekly sessions for months, years, sometimes decades. Therapist absolutely benefits from patient not getting better quickly. This is a structural problem. The anecdotal evidence. How many people do you know who've been in therapy for 1 year? Common. 3 years? Common. 5 years? Not uncommon. 10 years? Exists. 20 years? Exists. Are these people getting better? Or are they chronic patients in a system designed to keep them dependent? The rare honest therapist. Some therapists admit this, not publicly, but privately. If I cured all my clients in 6 sessions, I'd go bankrupt. Long-term clients pay my rent. I know some clients aren't improving, but they keep coming. They want to come. The incentive structure creates perverse outcomes. The lack of accountability. If you see a therapist for 3 years with no improvement, can you sue for malpractice? No. Therapy is not held to medical standards of effectiveness. Doctor. Expected to cure or significantly improve condition. Therapist. Just has to show up and listen. No guarantee of results. No accountability for outcomes. The counterfactual. What if therapists were paid for outcomes instead of sessions? Payment only if client improves measurably within 6 months. Would therapy look different? Would it be more effective? Would long-term dependent relationships disappear? Probably. But that model doesn't exist because the current model is more profitable. The pharmaceutical connection, the industry partnership. Therapy and pharmaceuticals work together. Therapist diagnoses you with depression, refers you to psychiatrist. Psychiatrist prescribes antidepressant. You continue therapy while on medication. Both profit. The medication effectiveness question. Do antidepressants work? Pharmaceutical companies say yes. Research is murky. Irving Kirsch meta-analysis 2008 reviewed FDA data on antidepressants, including unpublished trials. Finding: antidepressants barely more effective than placebo. Effect size clinically insignificant for mild to moderate depression. Only showed benefit for severe depression. Most people taking antidepressants have mild to moderate depression, meaning they're taking medication that barely works. The dependency model. Antidepressants are supposed to be temporary. Take for 6 months to a year, then taper off. Reality. Many people stay on them for years, decades. Why? Withdrawal symptoms when trying to quit. Brain adaptation to medication. Fear that depression will return. And pharmaceutical companies profit from long-term patients, not from cured patients. The research funding. Who funds mental health research? Pharmaceutical companies fund the majority. What gets researched? Medication effectiveness. What doesn't get researched? Non-medication alternatives. Why? No profit-improving therapy or lifestyle changes work better than drugs. The prescribing cascade. You see therapist for mild anxiety. Therapist refers to psychiatrist. Psychiatrist prescribes SSRI. SSRI causes side effects. Insomnia. Psychiatrist prescribes sleeping pill. Sleeping pill causes daytime drowsiness. Psychiatrist prescribes stimulant. You're now on 3 medications for mild anxiety that might have been solved by exercise and reducing caffeine. This is called a prescribing cascade, common in mental health treatment. The profit scale. Global mental health medication market, $200 billion annually. Therapy industry, $100 billion. Combined, $300 billion. This industry needs patients, chronic patients, not cured patients, what actually helps. The research on alternatives, what actually improves mental health. Research shows exercise as effective as antidepressants for mild to moderate depression. Social connection, strongest predictor of mental health and longevity. Purpose and meaning, work, contribution, clear role in community. Sleep. Sleep deprivation causes anxiety and depression symptoms. Nutrition. Gut-brain connection. Diet affects mental health significantly. Nature exposure. 20 minutes in nature reduces cortisol significantly. Meditation. Proven effective for anxiety and depression. None of these require a therapist. None of these cost $150 per session. The community solution. Mental health crisis is partly a community crisis. Modern society, isolated, nuclear families. Geographic mobility separates from extended family. No one knows their neighbors. Work colleagues aren't friends. Result? Loneliness epidemic. Loneliness increases risk of depression by 200%. Therapy tries to solve this by giving you someone to talk to once a week. 50 minutes. That's not community. That's a paid relationship. The meaning crisis. Viktor Frankl, psychiatrist, Holocaust survivor, wrote Man's Search for Meaning. His observation, people need purpose more than they need therapy. Modern society offers no clear purpose. Find your own meaning. This creates anxiety. Therapy tries to help you find meaning, but meaning comes from outside yourself. Contribution, service, belonging, legacy. Therapy can't give you that. The lifestyle medicine approach, emerging field, lifestyle medicine, treatment for mental health, exercise prescription, social connection facilitation, purpose cultivation, sleep hygiene, nutritional counseling, stress reduction. Results: comparable or better than therapy and medication. Cost: fraction of therapy cost. Side effects: positive, better physical health. Why isn't this mainstream? No profit for pharmaceutical companies, less profit for therapists. The uncomfortable truth: you're not sick. Most people in therapy aren't sick. They're experiencing normal human emotions in a dysfunctional society. You're not depressed because of a chemical imbalance. You're sad because your work is meaningless. You're isolated from community. You have no purpose beyond consumption. You're bombarded with comparison via social media. You sleep poorly, exercise never, eat processed food. This isn't a mental health problem. This is a society problem. Therapy medicalizes it, turns societal dysfunction into individual pathology. You're depressed. Here's treatment. Not, society is sick. Let's change it. The system needs you sick. Mental health industry is worth $300 billion. It doesn't profit from you getting better quickly, you realizing you're not sick, you fixing societal problems instead of medicating symptoms. It profits from long-term patients, expanded diagnostic criteria, medicalization of normal experience, chronic medication use. This isn't conspiracy, it's economics. The system follows incentives. The alternative, what if instead of therapy, you joined a community group, religious, secular, doesn't matter, started exercising daily, got 8 hours of sleep, deleted social media, found work that contributed something meaningful, built deep friendships? Would you still need therapy? Many people wouldn't, but the mental health industry can't tell you this because it would eliminate their customer base. You've been in therapy for years, talking about your childhood, your relationships, your anxiety. You're still struggling, but your therapist says, keep coming back. These things take time. Here's what they're not telling you. 50% of therapy clients don't improve. 5 to 10% get worse. Therapists profit from long-term clients, not cured ones. The mental health industry is worth $300 billion, built on chronic patients, not cured ones. Meanwhile, cultures without therapy often have better mental health outcomes. Community support, purpose, meaning, connection. These solve what therapy tries to solve, but can't. Because you can't buy community in 50-minute sessions. Research shows exercise, social connection, purpose, sleep, nutrition, all as effective as therapy, for free. But the industry can't profit from that. So they medicalize normal human emotions, create disorders from personality variations, keep you dependent on treatment. I'm not saying no one should ever go to therapy. Some people benefit, short-term, for specific issues. But long-term therapy, for years, that's not healing, that's dependence. And the system is designed that way. Therapy is an industry. It needs customers, sick customers, not cured ones. This has been Inner Pigment. Stay curious, stay questioning, and maybe ask, is your therapist helping you heal or helping you stay sick?